General principles of pharmacology. Absorption of drug. Absorption is the process by which a drug enters into the systemic circulation from the site of administration, except the intravenous or intraarterial route, through the biological barrier. In the case of intravenous or intraarterial administration, the drug is not absorbed and it enters into the circulation directly. Sites of absorption. The drug is absorbed from different sites of administration such as from the alimentary tract, parenteral sites except for the intravenous or intraarterial route, skin, eye, and respiratory tract. Alimentary tract. Every part of the alimentary tract, the oral cavity, stomach, small intestine, and rectum, are important while considering the absorption of drugs. The extent of absorption is greatest from the small intestine. Oral cavity. The oral cavity is lined with several layers of epithelial cells. It is highly vascular. The normal external environment of the epithelial cell is slightly acidic. Drugs are absorbed into the systemic circulation by simple diffusion. The area of the absorptive surface is relatively small and the time during which absorption occurs is also short. Following absorption within the oral cavity, the drug gains access to the systemic circulation without first traversing the liver. Stomach. The inner mucosal layer of the stomach has three components: a superficial layer, lamina propria, and the innermost thin small muscle cell layer. The superficial layer is composed of a single layer of epithelial cells. It is not a smooth surface but contains many folds. These folds increase the number of epithelial cells. Lamina propria contains connective tissue, blood vessels, and lymphatics. Only a limited amount of drugs is absorbed from the stomach. The extensive vascular supply to the stomach provides a good area for the absorption of the drug. But the surface area of absorption is less and the drug remains within the stomach for a short time. However, a significant amount of aspirin and alcohol is absorbed from the stomach. Small intestine. Like the stomach, the inner epithelial lining of the mucosal layer of the small intestine is composed of a single layer of cells. The mucosal surface is heaped up into folds of Kirkring. These folds are more numerous and deeper ruffled junctions called villi. These projections make an additional tenfold relative increase in the luminal surface area. Individual villus is lined with the primary absorbing unit epithelial cells and with goblets, the mucus-secreting cells. The central part of each villus contains the blood and lymph capillaries. Blood flow to the intestine is much greater than that of the stomach. Most drugs in the non-ionized form are absorbed from the upper part of the small intestine by simple diffusion. Ionized drugs are incompletely and slowly absorbed by filtration. Some drugs such as alpha-methyldopa, fluorouracil, levodopa are absorbed from the intestine by an active transport mechanism. Rectum. The absorption of the drug from the lower two-thirds of the rectum bypasses the first pass effect in the liver. Because middle and inferior rectal veins collect blood from these parts of the rectum and then drain into the inferior vena cava via the hypogastric vein. On the other hand, the drug absorbs from the upper part of the rectum passes through the liver because the superior rectal vein drains into the mesenteric vein and then into the portal circulation. The absorption of the drug from the rectum is slow, incomplete, and unreliable. The absorption occurs by simple diffusion. However, the extent of absorption is not large. The absorption of the drug from the rectal suppository is relatively inadequate. For example, less than 40% of an aspirin dose is absorbed from a rectal suppository. Some amounts of drugs undergo the first pass effect. The presence of stool in the rectum reduces the extent of absorption. Parenteral site. The capillary wall is the barrier to the absorption of the drug from the subcutaneous tissue and muscle. The permeability of the capillary in both areas is the same. The absorption of the drug into the systemic circulation from these sites occurs by simple diffusion. The absorption of the drug from the intramuscular site is usually more rapid and uniform than from the subcutaneous site because of the more extensive, vascular supply of the muscle compared with the subcutaneous fatty tissue. Skin. The outermost layer, the stratum corneum, is made up of scaly, squamous plaques of dead cells that contain keratin. This horny layer is thick over areas of the body subject to abrasion, such as the palms of the hands, and thin over other more protected areas. The absorption through the skin is also by simple diffusion, but the rate of penetration is comparatively slow. The absorption occurs more easily through the cell lining, sweat and sebaceous glands, and hair follicles than through keratinized epidermis because of its multiple cell layers. Respiratory tract. When we inhaled air, it passes through the pharynx and trachea into the lungs. Within the lungs, the bronchial tubes subdivide into the finer bronchioles. The bronchioles are then communicated with the alveoli, a total of 300 to 400 million in human lungs. The alveolus is the minute sac-like chamber that enables the lung to carry out its primary function of rapidly supplying oxygen to the body and removing carbon dioxide. Each alveolus is lined with a single layer of flat epithelial cells forming an extremely thin barrier, 0.5 to 1.0 pm thick, between alveolar air and an interstitium richly supplied with capillaries. It provides a total surface area of about 200 square meters. Chemicals are also inhaled as aerosols, which are liquid droplets or solid particles so small that they remain suspended in the air for some time instead of settling out quickly under gravitational pull. Gases are small molecules of relatively high lipid, water partition coefficient. So, it can instantaneously cross the cellular membrane of the alveolus by diffusion. Thus, the movement of gas from the alveoli to blood and vice versa depends on the site of high concentration. This principle is applied to anesthetic gas like nitrous oxide. Factors modifying absorption of the drug. When we consider the factors modifying the absorption of the drug, we usually mean the factors affecting the absorption of the drug from the alimentary tract. But the factors which affect the absorption of the drug from the site of administration other than the oral route should not be ignored. So, some factors modify the absorption from the alimentary tract, parenteral sites except intravenous administration, and skin. Alimentary tract. There are several factors related to drugs and related to the patient that affects the absorption of drugs. The factors related to the drug are molecular weight, size, lipid, water partition coefficient, pKa, formulation, disintegration, dissolution, inactivation, and interaction with other drugs. The factors related to the patient are pH of the gut, rate of gastric emptying, presence of food in the gut, bowel transit time, the mucosal surface area available for absorption, regional blood flow, and gastrointestinal diseases. Molecular weight, size, lipid, water partition coefficient, pKa, formulation, disintegration, and dissolution have already been described previously. Inactivation. The drugs may be inactivated or metabolized in the alimentary tract before they are absorbed. For example, orally administered oxytocin or insulin is inactivated by the enzyme chymotrypsin present within the alimentary tract. The drugs may be inactivated by biotransformation during their passage through the intestinal wall and by the gut bacteria. Diazepam is also metabolized in the intestinal mucosa immediately after absorption and before the drug can pass into the portal venous blood. Interaction with other drugs. When two or more drugs are administered simultaneously, one drug may affect the absorption of other drugs or vice versa. Calcium, iron, aluminum, and magnesium reduce the absorption of tetracycline. Phenobarbital reduces the absorption of griseofulvin. Alcohol weakens the barrier to the passage of iron salts and causes excessive absorption, which may cause disease due to iron pigment accumulation in the tissues. pH of the gut. The pH of the gut has important consequences for the absorption of the drug because it can dramatically affect the degree of ionization of the drug. An increase in pH of the gut leads to an increased fraction of weak base being nonionized, and an increased fraction of a weak acid being ionized in the gastric juice, and consequently the absorption of the ionized form of the drug from the stomach will be slow. On the other hand, weak acid paracetamol, pKa equals 9.5, will exist mainly in its nonionized form and can readily diffuse from the stomach into the circulation. Rate of gastric emptying. The rate of gastric emptying markedly influences the drug absorption irrespective of their acidic, basic, and neural properties. The greater the emptying rate, the greater the rate of drug absorption and vice versa. In general, factors that increase the gastric emptying rate will increase the absorption of the drug unless it dissolves slowly. There are some factors such as volume and constituent of gastric content, physical activity, the position of the body, and drugs that influence the gastric emptying rate. For example, the small volume of diet decreases whereas large volume increases the gastric emptying rate. Patient lying on the left side decreases the rate of gastric emptying compared with lying on the right side. A fatty diet decreases the rate of gastric emptying compared with the effect of carbohydrate foods. Muscarinic cholineceptor antagonists such as atropine decrease the gastric emptying rate. Metoclopramide increases the gastric emptying rate. The rate of gastric emptying may be unpredictable due to several factors. Thus, it is advisable to take a drug with water on a relatively empty stomach to conclude that it will reach the small intestine rapidly. Bowel transit time. Bowel transit time is the time required for a particular foodstuff to pass through the bowel. It may be classified into small and large bowel transit time. Bowel transit, particularly small bowel transit, may influence the absorption of the drug by altering the time during which a drug is in contact with small bowel mucosa. Bowel transit time is mainly dependent on its motility. It decreases in case of increased intestinal motility, which tends to decrease the absorption, the opposite being the case for increased bowel transit time. Mucosal surface area available for absorption. The greater the surface area of the epithelial layer, the greater will be the extent of absorption. Due to its many folds, villi, and microvilli, the mucosal surface area of the small intestine is 600-fold greater than that of the stomach. So, the extent of absorption is the greatest from the intestine. Gastrointestinal diseases. Several gastrointestinal diseases can affect the absorption of the drug. For example, celiac disease and Crohn's disease may change the pattern of absorption so that more drug is absorbed from the gastrointestinal tract. Gut edema in a patient with congestive cardiac failure may reduce the absorption of diuretics. Generally, the drugs with high lipid water partition coefficient continue to be well absorbed despite extensive gastrointestinal disease, whereas absorption of water-soluble drugs such as digoxin, tetracyclines are more likely to be important. Presence of food in the gut. The presence of food in the gut influences the extent of drug absorption. Most of the drugs are better absorbed on an empty stomach. Food interferes with the absorption of water-soluble drugs. Ampicillin, aspirin, doxycycline, isoniazid, levodopa, oxytetracycline are considered as examples. So, these drugs are best taken at least 1 hour before a meal for better absorption. However, drugs producing gastrointestinal irritation such as aspirin should be taken during or immediately after a meal, although food decreases its absorption. The lipid water partition coefficient of a drug also influences the extent of absorption. The drug with a high lipid water partition coefficient shows increased absorption in the presence of food. These are griseofulvin, hydralazine, mefloquine, nitrofurantoin, riboflavin, propranolol, and spironolactone. So, these drugs are best taken during a meal. Parenteral. The extent of absorption from the parenteral site except intravenous or intraarterial administration depends on the site of infection, b. area of absorptive surface, c. blood flow, d. the time of contact with the absorptive surface, e. the concentration gradient, and f. dosage formulation. The absorption of the drug from different parts of subcutaneous tissue is not the same. For example, it is rapid from the subcutaneous tissue of the abdominal wall, followed by the arm, buttock, and thigh. Rubbing the site of infection increases the extent of absorption by increasing the surface area of the drug as well as by increasing the vascularity of that area. For example, 1 milliliter of the drug when producing a spherical form would have a surface area of 4.84 centimeters. If the same amount of drug produces a disc of 1 millimeter thick, it would have a surface area of 21.07 centimeters. Thereby, we can increase the surface area of the drug several times simply by changing the shape of the absorptive surface. The rate of absorption of the drug from subcutaneous tissue and muscle is the same when the muscles are at rest. But during activity, the blood flow to the muscle tissue increases and thereby increases the rate of absorption. The blood supply to the superficial area can be increased by applying heat, hot bath, local vasodilators, massage, or exercise. Increased blood supply causes an increase in absorption. In the upright posture, subcutaneous blood flow diminishes considerably in the legs, and to a lesser extent in the abdominal wall. On the other hand, the use of a tourniquet or cold decreases the blood supply to the superficial area and thus decreases the absorption of the drug. The dosage formulation affects the absorption of the drug from the parenteral sites. For example, drug in an aqueous solution is usually absorbed more rapidly than the skin. The degree of absorption from the skin depends upon several factors such as surface area, concentration gradient, and lipid-water partition coefficient. The absorption of the drug will be better if the sebum is washed off before the drug is applied. The rate of absorption through the skin is determined by thickness and vascularity. For instance, hexachlorophene, an antiseptic, is quite safe when used in the skin of healthy adults and children, but sufficient amount of hexachlorophene will be absorbed and may cause damage to the nervous system after its use on the skin of premature infants or burned skin. Inflammation significantly increases transdermal absorption. Many drugs produce their responses after absorption through the epithelium of the conjunctival sac. In this case, the adequate lipid solubility of the drug is essential for adequate absorption. Respiratory tract. The degree of penetration of the drug into the respiratory tract depends upon the size of drug particles in solid and liquid aerosols. The rate of absorption is rapid due to the high surface area of the alveoli and the high vascular supply of the lung. Solubility of the drug is also an important factor. Greater the rate of dissolution of the drug, the greater the rate of absorption. Insoluble particles are dangerous only if they reach the alveoli. Drug particles larger than 10 microns are trapped in the respiratory tract, whereas the size of less than 2 microns can enter the alveoli. Bioavailability. The term bioavailability means the fraction of administered dose which reaches the systemic circulation from the particular form. It can be calculated as the ratio of the area under the oral, or another route, and intravenous concentration time curves. Bioavailability is expressed in percentage. If drug A occupies an area of 70 smallest squares following oral administration and 175 smallest squares following intravenous administration, then the bioavailability of that drug is 70/175 equals 40%. The bioavailability can vary among different dosage forms of a drug. The extent of absorption and first-pass biotransformation are the important factors on which bioavailability largely depends. The extent of absorption is the total amount of drug that undergoes absorption, and it is directly proportional to bioavailability. First-pass biotransformation is inversely proportional to bioavailability. The bioavailability of a drug given chronically may differ from that following a single dose, as the bioavailability of the gut and liver enzymes to metabolize a drug at the first pass can be saturated.